Hi guys, it's Dr. Jen here from Right Way Health and Wellness. I have a question for you today. With all that's going on in society today, are you getting more concerned about your health the way it is today and about your health for the next several years? I think we are. I think we're paying more attention to what's going on in our body. That way we can protect ourselves and we don't have to be a victim. So you may ask yourself, what is the single thing, Dr. Jen, that I should pay attention to more than anything else? If I don't do anything else, what should I pay attention to? And I can tell you, that's inflammation. And the reason inflammation is so critical is that it has been found to be a key player in almost every chronic disease process. It's affecting approximately 133 million Americans. That represents more than 40% of the total population in the United States. And it's worldwide. And if inflammation hasn't been shown to be associated with a chronic disease, it's probably just because no one has looked for it. You probably wouldn't be surprised to hear that inflammation is a major part of autoimmune diseases, since they are all directly caused by the immune system. Well, maybe you've also already heard that white blood cells that sneak into the walls of your arteries are major contributors to cardiovascular disease, meaning it's not just about cholesterol buildup. Perhaps you know that cancer tends to form in areas that are chronically inflamed. But what a lot of people don't know is they don't expect inflammation to be a component of osteoarthritis, a disease that scientists thought was just from wear and tear of the bones, maybe too much tackle football or tennis, but it wasn't certainly from inflammation, and now we know it is. Inflammation even plays a role in hypertension and in depression. So what is chronic inflammation? Well, let's back up for a moment. Let me give you a very brief primer on inflammation. It's a complex system in our body with an ever-growing list of identified components, but the big picture is that it occurs in two main ways. It can be a self-limited response to an injury or infection. For example, if you get a paper cut or you sprain your ankle, that's a natural immune response, and you're supposed to develop inflammation in that area. That's acute inflammation. But the other kind of inflammation that you don't want is called chronic inflammation. It's problematic in every case. It may occur if the immune system is trying to fend off infection. Let's say, for instance, you have Lyme disease, but it isn't having success. Or it may occur if the immune system becomes confused, such as if someone who has antibodies to like gluten that also end up attacking other parts of the body that resemble gluten. So it's kind of blindsided. Inflammation also happens when the immune system senses that something isn't quite right, such as when the LDL cholesterol makes its way into the lining of your arteries. White blood cells will follow, but instead of fixing the problem, they inadvertently make it worse by making the plaque unstable and more likely to rupture. So what are the signs of chronic inflammation that you should be looking for? Well, I'll give you a wide range of them, and then I'll give you the top 5. So constipation is a sign of chronic inflammation. Acne, irritable bowel syndrome, allergies, SIBO, metabolic syndrome, anxiety, depression, leaky gut, stress, migraines, feeling tired, can't focus, brain fog, any autoimmune disease, rosacea, all of that is a wide span of symptoms that you should be looking for. But the top 5 symptoms would be body pain, such as joint pain, pain anywhere on the body that you apply pressure, skin rashes, excessive mucus production, low energy, chronic fatigue, poor digestion. These are all signs of chronic inflammation that you need to be paying attention to. So what do? If you have these symptoms and you know that you have chronic inflammation? First step is to change your diet to an anti-inflammatory diet. You need to know what your sensitivities are, what types of foods your body may respond negatively to that creates inflammation in your body. Now we know gluten, sugar, and dairy are known inflammatory foods, but some people have sensitivity to artichokes, to broccoli, other things because of certain phenolics in them that they have either ingested too much of them and built a sensitivity to, or they're just sensitive to, and it creates inflammation. So you need to know what your food sensitivities are, and you can find that out by either doing the Cocoa Pulse test when you try a food that you think you may be sensitive to. A Cocoa Pulse test is where you take your pulse for 1 minute, and it can be anywhere 50, 60, 70. You eat your food, you take it again. Now, if your pulse jumps 10 points after eating a certain food, you know that you're probably sensitive to that food and it is creating inflammation in your body. You can also see a doctor like myself and get the Zyto biofeedback on the food allergies and sensitivities. So you can do it that way as well. There's blood tests that you can see, although they're not quite as sensitive as biofeedback is. So diet is a key component. Also figuring out ways to reduce your stress. Stress triggers cortisol, which creates inflammation in the gut. So if you're experiencing a lot of bloating, a lot of gut issues, you want to pay attention to the stress that you are under. So those are some simple ways that you can work on it at home on yourself. If you have chronic stress and you're already in a disease process, I encourage you to get a full Zyto biofeedback testing so your practitioner and you can look at exactly what created the perfect storm in your body that caused the disease process and help you work through that. Whatever the body creates, the body can heal if given the proper nutrients in the right environment. So that is our topic today, is on identifying if you have chronic inflammation and how to do that. And I thank you for your attention, and God bless, and have a happy, healthy week.